Hello guys, welcome to our channel. Today we are discussing about second lecture of our diabetes mellitus. In previous lecture we are studied that what is a diabetes and what is a type 1 diabetes. In this lecture we are discussing about type 2 diabetes, sign and symptoms and diagnosis of diabetes mellitus. In this lecture we are started with type 2 diabetes. Type 2 diabetes, formerly called as a non-insulin dependent diabetes, is a disorder that is characterized by the high blood glucose in the context of insulin resistant and relative insulin deficiencies. What cause type 2 diabetes? Type 2 diabetes occur when the pancreas doesn't make enough insulin or the cell of the body become resistant to insulins. Means there is a presence of insulin but the cells are resistant to that insulin. Insulin is unable to decrease the level of sugar in the blood. But in type 1 diabetes there is absence of insulins, and in type 2 diabetes there is a presence of insulin. Type 2 diabetes, formerly known as non-insulin dependent diabetes mellitus, probably caused by the disturbance in the insulin reception in the cells. Decrease in the number of insulin receptor cause type 2 diabetes. Loss of beta cell responsiveness to glucose leading to slow or insulin release by the pancreas. Occur over the age of 14 but can occur in children also. Common in overweight or obese persons. Some circulating insulin presence often does not require insulin. Gestational diabetes. It is a third main type of the diabetes occur in a pregnant woman without the previous history of diabetes. Etiology of diabetes. Genetically, type 1 diabetes or pre-diabetes or gestational diabetes can develop due to the poor diet, inadequate exercise. Pre-diabetes or type 2 diabetes, gestational diabetes occur by inadequate exercise and poor diet. Develop due to the following factors like overweight, high blood pressure, hypertension, high cholesterol, family history of diabetes. Diabetes is also a genetic factor, means our ancestor having diabetes, then we have also a diabetes. It is not that our ancestor have diabetes, we also suffer from diabetes, but it may occur. African American, Asian American, Latin American, Native American ethnicity, they are common to diabetes. Family history of gestational diabetes. Manifestations, symptoms and disease management. Two tests doctor use to diagnose diabetes and a pre-diabetes. FPG, fast plasma glucose test. Patient must fast for 8 hours. Doctor will mix blood with other liquids to determine the amount of sugar or glucose in the blood. And second is oral glucose tolerance test. This fasting test is take before our meal, and this is oral glucose tolerance test is after the meal. Doctor measure how well your body react to average dose of sugar. Patient will be drawn blood 2 hours before and after she and he drinks pre-mixed beverage with the sugar. Sign and symptoms of diabetes. The classical symptoms of untreated diabetes are weight loss, polyuria, increase in urination means polyuria, polydipsia, increased thirst, polyphagia, increased hunger. These are the symptoms of diabetes. Symptoms may be developed rapidly week or month in type 1 diabetes, while they usually develop much more slowly and may be present in a type 2 diabetes mellitus. Sign and symptoms is, in addition, they also include blurry vision, headache, fatigue, slow healing of cuts, itchy skin. There is a loss of blood in the diabetic patient for long time. Prolonged high blood glucose can cause glucose absorption in the lens of eyes, which lead to the change in the shape and resulting in a vision change. Vision is also important for the diabetes symptoms. Number of skin rashes that can occur in a diabetes are collectively known as diabetic dermatome, important term for NEET. Complications. Primary complication of diabetes due to the damage in small blood vessels include damage to the knee, kidney and nerves. The whole damage is due to the diabetes. Damage to the eyes, known as diabetic retinopathy, is caused by the damage to the blood vessels in the retina of the eye, can result in a gradual vision loss or blindness. Blindness also occurs due to the diabetes. Damage to the kidney, known as diabetic nephropathy, related to nephrons, can lead to the tissue scarring, urine protein loss, proteinuria, ketonuria. Eventually, chronic kidney diseases sometimes require dialysis or kidney transplant. These are the remedies for the diseases. It also causes damage to the nerves of the body, known as a diabetic neuropathy. Is the most common complication of diabetes. How should you treat high blood sugar? If your sugar is above 1 to 40, you should be do following methods for less down our sugar count in our blood. Drink lot of sugar free fluids like water or diet drinks. Eat the right food and right amounts. Check your blood sugar more often. Check ketones if it is over 240. Call doctor or nurse if you have a positive ketones. Management of diabetes mellitus. Major component of treatment of diabetes are ABC. Diet and exercise is very important. Oral hypoglycemic therapies, insulin therapies. Insulin therapy is last stage therapy for the diabetes mellitus. Point to note that diet is a basic part of management in every case. Treatment cannot be affected unless adequate attention is given to ensuring appropriate nutrition. Dietary treatment should be aimed at the ensuring weight control, providing nutritional requirements, correcting any association blood lipid abnormalities. Exercise includes physical activity, promotes weight reduction, improves insulin sensitivity, thus lowering blood glucose level. Physical exercise and our life changes, lifetime changes can occur, and this also increase the chance of patient to take over the diabetes. Together with the dietary treatment, the program of regular physical activities, exercise should be considered for each person. The program must be trial to the individual health status and fitnesses. This is about today's lecture. Thank you for watching. Please share this lecture to our friends, like, subscribe this platform. Thank you for watching.